Liposuction is a very popular procedure. People are concerned with various parts of their body and would like a minimally invasive way of improving that. And oftentimes people who are fairly physically fit have problem areas, and liposuction is a fantastic procedure for that. Otherwise healthy patients who have problem areas, for women it's their lower abdomen and waist, and for men it's often their waist, that they just find it hard through exercise and diet to improve on those, and liposuction is a great answer for those patients. So liposuction procedure can be done here in the office, actually in the operating room, with a minimal amount of anesthesia. So the recovery can actually be fairly quick. They don't have the recovery of general anesthesia. My patients say they feel like they're achy in the area that they've been operated on for a few days. And I ask them to not have significant activity for the first couple of days, but their recovery is pretty quick. In terms of what they should expect, they're going to be swollen for a good couple of weeks. It's part of liposuction. Patients are wearing a garment, which is a constricting binder that helps decrease the swelling. They're wearing that for 3 weeks, and then patients ultimately start seeing those results at that point. So when patients have liposuction done under local, they have really a minimal recovery. It's a couple of days of feeling achy in the area that was treated, but when they're not having general anesthesia, the recovery is actually fairly quick. So the ideal candidate for liposuction is someone who's otherwise fit, who has problem areas, and is at a good and stable weight. Those patients who are healthy, non-smoking, do very well with these body contouring procedures, and I say that these patients who have fit fat do very well with this procedure. So when patients come for a consultation for liposuction, I'll meet them, we'll discuss their medical history, make sure any procedure is safe for them, and then I'll examine them. And they'll point out their problem areas, and then we'll discuss their options. Sometimes liposuction is great for patients. They need to remove that fat. For some patients, removing that fat is actually only part of the process, so some people need to talk also about a surgical procedure. So that would be somewhat more than liposuction. It might be a tummy tuck, and that would all be discussed at the time of a consultation.